INGLE'S Endodontics, Edition 6. The author named John I. Ingle has done TDS MSD and is now a lecturer at Loma Linda University School of Dentistry, Loma Linda, California. Leaf K. Backlund and J. Craig Baumgartner. Dedication. The editors of INGLE'S Endodontics are proud to dedicate this edition to two of the most inspired beloved beloved teachers and practitioners of endodontics during our generation, Dr. Dudley H. Glick and Dr. Alfred L. Frank. True gentlemen, old famous innovators, old famous innovators, and the costlier and the closest of friends. So close, a, All and Dudley were often referred to as Al Glick and Dudley Frank. Both practiced in Beverly Hills, both in a bevy of famous patients. They could have been long-time competitors. They could have been long-time competitors. Instead, they were inseparable. Damon and Pythias, professionally, academically, and socially. Professionally, academically, and socially. Their wives, Ellie Glick and Terry Frank, are the very best of friends. Between them, they have 8 sons. Both were born, raised, and educated in Ohio. They served with honor and decoration in World War II, and following the war, Dudley and AI, Dudley and Al were both graduated in dentistry from the University of South California as pre-doctoral dental students. They were infamous for their unusual interest in endodontics, in a school famous for its restorative dentistry. Upon graduation, they both started general practices in the Los Angeles. Upon graduation, they both started general practices in the Los Angeles area and were soon noted for their superb restorative dentistry. They joined the endodontic faculty at USC, and when the word of their endodontic skills spreads, referrals started to pour in. They joined the endodontic faculty at USC, and when word of their endodontic skills spread, refer- referrals started to pour in. After consulting a number of endodontic friends, they took the leap and announced they were limiting themselves to endodontics. Among the first really full-time endodontists in Southern California. They were the last of the self-trained endodontists. They were the last of the self-trained endodontists. Self-trained, that is, by taking every postgraduate endodontic course and attending available meetings and visiting professionally with the nation's best known endodontists, first on the West Coast and then nationwide. They were the last of the self-trained endodontists. Self-trained, that is, by taking every postgraduate endodontic course and attending available meetings and visiting professionally with the nation's best known endodontists, first on the west coast and then nationwide. Over the years, they they became the endodontists endodontists over the years they became the endodontists. If we ourselves needed root canal treatment, we would travel across the country to have either all or Dudley perform the treatment. That much fame they have earned. There were there were there was never a fee. They were proud of the trusted they were proud of the trust placed in them. They were proud of the trust placed in them by other skilled professionals. In fact, dentists, physicians, and the clergy were rarely charged in their offices. That was their strong belief in professional courtesy, and everyone else paid the same fee. Whether you were Cary Grant, Nancy Reagan, Mae West, or the or Joe the plumber, ex- except teachers who received a reduced fee. As they gained in renown, both Al and Dudley were inundated with requests to speak to national and foreign audiences. No one made and retained so many devoted friends around the world. No one made and retained so many devoted friends around the world. Their homes in Beverly Hills became a haven for the famous and the students alike, sometimes for weeks at a time, as young people came to learn from the masters. They never ceased their dedication to teaching at USC, at UCLA, at Loma Linda, and at Cedars Sinai Hospital. Both Dudley and Al were honored over and over by societies and universities alike. They became famous locally. They became famous locally, nationally, internationally, yet remained the same modest, generous, considerate, literally lovable gentleman they always were, brimming with integrity and honesty. That is what endeared them to those of unfort that is what endeared them to those of us fortunate to have been their friends and disciples. Disciples means something followers, students, employees, and patients. We only wish the entire specialty profession had the had had the same opportunity. These were the pictures of Dr. Dudley H. Glick on the left side and Dr. Alfred L. Frank on the right side. The sixth edition of Endodontics is replete with new innovations and knowledge. Now, more than ever, it remains the Bible of endodontics, a name long applied by others to the previous editions. I feel comfortable as I pass the torch to the new editors, Leaf Backland and Craig Baumgartner, and I have a feeling the profession will come to its senses, veering off pull and be damned road and on to the road best travelled. Contents of this textbook: 1. The discipline of endodontics. In it includes Chapter 1 Modern Endodontic Therapy, Past, Present, and Future. 2. History of Endodontics. 3. Ethics, Morals, the Law, and the Endodontics. 4. Effects of dental implants on treatment planning for prosthodontics, periodontics, and endodontics. 3. Unit 3 Pathobiology. 5. Structure and function of the dentin pulp complex. 6. Morphology of teeth and their root canal systems. 7. Morphology of endodontic disease. 8. Non-microbial endodontic disease. 9. Inflammation and immunological responses. 10. Mechanisms of odontogenic and non-odontogenic pain. 11. Non-odontogenic toothache and chronic head and neck pain, which is a chapter to be read. Non-odontogenic toothache and chronic head and neck pain. 12. Pulpal pathosis. 13. Periapical lesions of endodontic origin. And this is very key. Pathobiology is key to understand, comprehend, and analyze, because it is the basis for future studies. Now let's move on to the unit 4: examination, evaluation, diagnosis, and treatment planning. Chapter 14: Diagnosis of endodontics includes A. Endodontic instrumentation. B. Diagnostic testing. C. Laser Doppler flow meter. And Chapter 15: Diagnostic imaging includes A. Endodontic radiography. B. Digital imaging for endodontics. C. Ultrasonic imaging. And Chapter 16: Radiographic interpretation includes Chapter 16 Radiographic interpretation. And Chapter 17 Rhinosinusitis and endodontic disease. Chapter 18 Endodontic periodontal interrelationships. Chapter 19 Tooth infarctions. Chapter 20 Vertical root fractures of endodontically treated teeth. This is important to consider, which are special cases. Vertical root fractures of endodontically treated teeth. Chapter 19 Tooth infractions. Now coming to the main concept. Now you have came across the foundation in the pathobiology. how do you diagnose the case you come across in the examination, evaluation, diagnosis. After diagnosis, you have postulated a treatment plan. Now, coming to the management, right? You have postulated a treatment plan. Now, how do you manage that case? Let's talk about in Unit 5. Includes Chapter 21 Treatment of endodontic infections, cysts, and flare ups. Chapter 22 Pharmacologic Management of Endodontic Pain. Chapter 23 Anxiety and Fear in the Endodontic Patient. That means the patient who has the tooth infection, pulpal pathosis. 24 Chapter 24 The Medically Complex Endodontic Patient. Chapter 25 Drug Interactions and Laboratory Tests. Chapter 26 Endodontics Instruments and Armamentarium. A. Dental dam and its applications. B. Introduction of nickel titanium alloy to endodontics. C. Instruments for cleaning and shaping. D. Electronic apex locators. E. Lasers in endodontics. F. Visual enhancement. Chapter 27 Preparation of coronal and radicular spaces. 20 Chapter 28 Irrigants and intracanal ligaments. Chapter 29 Root canal filling materials. Chapter 30 Obturation of the root radicular space. Chapter 31 Retreatment of non-healing endodontic therapy and management of mishaps. Chapter 32 Treatment outcome. The potential for healing and retained function, which is the crucial and one of the important steps to master in this management part, which is the crucial part. Now, Unit 6 Surgical Procedures in Endodontics. Chapter 33 Endodontic Surgery. Chapter 34 Osseointegrated dental implants. Now, Unit 7 Related Endodontic Treatment. Chapter 35 Vital Pulp Therapy. Chapter 36 Endodontic Considerations in Dental Trauma. Chapter 37 Pathologic Tooth Resorption. Chapter 38 Tooth Discolorations and Bleaching. Chapter 39 Endodontic Therapy for Primary Teeth. Chapter 40 Restoration of endodontically treated teeth. One case we already discussed. There are chances of vertical root fracture in endodontically treated teeth under certain circumstances. Now, Chapter 41 Operations Management in Endodontic Practice. Now, finally, you come across the index in 1513. Right.